Nowadays, everywhere we hear one thing: Corona, Corona, and Corona. What is Corona? Actually, this is a disease caused by coronavirus, which is responsible for worldwide pandemic. As we know that the main country affected is China, where more than 90,000 confirmed cases have been reported. Cases of this new infection were first reported in Wuhan, China in early December 2019. The World Health Organization named the disease COVID-19. In January 2020, the World Health Organization declared a global health emergency due to coronavirus from China.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
So we need to discuss straight away that what is coronavirus, how does this virus work, and how does this virus transmit, where does it wanna go, and how to protect ourselves. Hi, I am Dr. Huck and you are watching my YouTube channel Live Healthy. If this is first time you are visiting my channel, make sure you press the subscribe button. Also hit the bell icon to get updates on coronavirus as well as other health issues. Coronavirus is a large family of viruses which may cause illness in animals or humans. These viruses are transmitted between animals and people. In humans, several coronaviruses are known to cause respiratory infections ranging from common cold to more severe diseases such as MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. The most recently discovered coronavirus causes coronavirus disease COVID-19. It had not previously been identified in humans. In fact, corona is a Latin word meaning crown. Under microscope, coronavirus looks like a crown, that's why it is called corona. Basically, this virus looks like a crown or a tennis ball with spikes sticking out of it. Depending on the type of spike, it allows the virus to attach to certain places. So some viruses have the spikes that attach to our nose, that's why we get common cold. But the SARS virus or the new coronavirus we are talking about has the spikes that allow it to attach to the cells in our lungs. It cannot reproduce without hijacking our body cells. It hijacks our DNA machinery from our cells to make copies of it. So once it attaches to the cells of our lungs, it takes over the cellular machinery to make more and more copies of itself. And in this way it can be spread to surrounding cells to get into the mucus. It is unclear exactly how contagious the new coronavirus is or how it spreads. Research is ongoing. But it is believed that just like all viruses, it needs to reach a target, which is our lungs in this case. It has no feathers, no wings, so therefore it needs us to move over there. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs, sneezes or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes or nose or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. It appears to be spreading from person to person among those in close contact. This is why we say don't hang around the sneezy people or people having cough. It is best to stay more than 1 meter, round about 3 feet away from a person who is sick. Its incubation period is from 2 to 14 days. The incubation period means the time between catching the virus and beginning to have symptoms of the disease. So once a person is infected, the symptoms develop from 2 to 14 days. This is called the incubation period. However, the incubation period varies from person to person. In some studies, it lasts for up to 24 days. An average incubation period is 5 days. Signs and symptoms of infection with COVID-19 can be mild to severe. Some people become infected but don't develop any symptoms and don't feel unwell. For others, they can develop symptoms ranging from pre-mild such as fever, dry cough, and shortness of breath, all the way to serious problems like pneumonia. Symptoms may appear from 2 to 14 days after exposure. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Severe lungs damage can cause acute respiratory distress syndrome (ARDS), which occurs when the lungs inflammation is so severe that fluid builds up around and within the lungs. The severe infection can cause septic shock, which happens when the blood pressure falls dramatically and body organs are starved for oxygen. ARDS and shock are the main causes of deaths for people with the infection. This is more likely to occur in those who are the age of 60, smokers, or having previous medical conditions such as diabetes and hypertension. So far now, the goal is to prevent its human-to-human transmission, starting with isolating the infected individual. Coronavirus usually does not spread over a long distance in the air, but they can travel roughly 3 feet or 1 meter from one person to another through tiny droplets of saliva which are produced when someone coughs or sneezes. So stay at least 6 feet or 2 meters away from anyone with symptoms. In addition, some strains of coronavirus can survive on surfaces for over a day. Although there is no vaccine available to prevent infection with the new coronavirus, you can take steps to reduce your risk of infections. WHO and CDC recommend that you take the usual precautions to help prevent the spread of respiratory viruses. For example, wash your hands often with soap and water or use alcohol-based hand sanitizer. Because washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Also maintain at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Because when someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain virus. If you are too close, you can breathe in droplets including the COVID-19 virus. Also avoid touching eyes, nose and mouth, because hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and can make you sick. Make sure you and people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Because droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu and COVID-19. Stay home if you feel unwell. If possible, avoid traveling to places, especially if you are an older person or have diabetes, heart or lung disease, because you have a higher chance of catching COVID-19 in one of these areas. Avoid close contact with anyone who is sick. Stay home from work, school and public areas if you are sick. Avoid sharing dishes, glasses, bedding and other household items if you are sick. Clean and disinfect surfaces you often touch. WHO also recommends that check with your doctor if you have fever, cough and difficulty breathing, and tell him or her about any recent travels. Avoid eating raw or undercooked meat or animal organs. If you are visiting live markets in areas that have recently had cases of new coronavirus, avoid contact with live animals and surfaces they may have touched. Contact your doctor right away if you have symptoms of infection with new coronavirus and you have possibly been exposed to the virus. Also, let your doctor know if you have had close contact with anyone who has been diagnosed with coronavirus disease. Your doctor may take samples including sample of saliva, sputum, a nasal swab and a throat swab to send to the lab for testing. In fact, more than 80% people infected with COVID-19 recovered without any special treatment. However, for those who are very young, very old or already battling illness, it can be really serious. Currently, no antiviral medication is recommended to treat infection with the new coronavirus. Treatment is supportive and may include pain relievers, cough syrup, rest, and fluid intake. If a patient has difficulty in breathing, we can give him oxygen to help breathing. If your doctor thinks you can be treated at home, he or she may give you special instructions, such as to isolate yourself as much as possible from family while you are sick, and to stay home for a period of time. If you are very ill, you may need to be treated in the hospital. On March 19, President Donald Trump boasted about the very encouraging results of two drugs called chloroquine and hydroxychloroquine as treatment for the novel coronavirus, claiming that the medications have gone through the approval process and we are going to be able to make that drugs available almost immediately. But the US Food and Drug Administration (FDA) swiftly issued a statement to clarify that no, these drugs are not approved as treatment for COVID-19.